move on and still on matters health. And meanwhile, Kenya Union of Clinical Officers in Nyeri are asking to be included in the negotiations with the doctors. Speaking at the Nyeri County Referral Hospital, the clinical officers said that they are overworked and underpaid. The clinical officers were speaking at the Nyeri County Referral Hospital.
Long strike that has hit all parts of the country in public facilities, and we're talking to clinical officers here from Nyeri County who have just called or are calling for a press conference. They have a number of issues to raise, particularly feeling that they have been left out of the negotiations, and they're having to do the bulk of the work, and they feel that they're also important to this equation, that they need to be heard. And perhaps to give us a further insight into this very critical matter, we are talking to the clinical officers in Nyeri County. Thank you. We are on KTN News. Kindly introduce yourself and perhaps you can delve into the issues that you have.
Okay, my names are Anne Caroline Modoni. I work as a clinical officer anesthetist in PGH Nyeri, and we are here. I also represent the Kenya Clinical Officer Association as a Secretary General, Nyeri County. Why we are here today is because left, right and center, we are not being heard, we are not being felt. So we have decided to come out strong, create awareness that we are clinical officers and we are very proud of it. And on top of that, we also have specialized clinical officers who are ENT specialists, we have anesthetist specialists, we have orthopedic specialists, we have pediatric specialists, we have ophthalmology specialists, lung and skin specialists. Basically, if I would elaborate on that, we have specialized in all areas. So we are the ones who actually handle the patients. The first person who encountered the patients is a clinical officer, and actually we run the outpatient department plus the casualty. That is what we actually do in all health sectors, be it the health centers, be it the dispensary, be it the big government hospitals, including even KNH. Basically, the clinical officer is the one who handles the patient as the first person. Number two, we are here because we want the people out there, our clients, our patients, to know that we play a very major role in this country, and the person you handle is the clinical officer. Also, we are also appealing to the government as they consider the allowances. We might have an interim certificate for the union, but we might not actually have a certificate for it. But we want to be heard. We need the allowances just like the other people who need the allowances, because at the end of the day, we actually are the risk takers. We are actually the risk takers because even if a patient comes with Ebola today, the clinic officer is the one who is going to actually contract it as the first person, because we are the first person who diagnoses, who sends the patient for investigations, who decides whether the patient is actually going to go to the theater, who is going to go to the wards, and who is also going to be booked in the clinics, in the consultant's clinic. So we are appealing to the government of Kenya, from the president, from the Minister for Health, do not sideline us, because you know very well, do not shy away from us, because we play a major role in this government.
All right, thank you. Maybe if we could hear from another gentleman, kindly introduce yourself and tell us, or you could add more what she has not addressed.
Yes, I'm Peter Dirangu. I'm a clinical officer, pediatrician. And like my Secretary General has clarified, we have played a very big role in this country, right from the time of independence to right now, whereby we are seeing government sidelining the clinical officers. I can really tell you, the nation, that clinical officers handle 90 to 95% of the patients in the country. The remaining 10% are the patients who are very sick, who requires operations, who are supposed to be taken to the ward for follow-up. And we are actually the people who start their treatment. So we can say very clearly that we can learn private and public hospitals very well. Having undergone thorough training for 3 years, we go back to the wards for a whole year. We take a 1 year internship. Thereafter, if you want to go for specialty, you go for specialty. 2 years, then you continue providing services in the country. So we are also asking the government, promoters, reward us like any other profession in this medical field. Thank you so much.
Okay, as pertaining the strike, what would your comments be? Kindly just introduce yourself. Yes.
My name's Lucy Kimani. I'm a clinical officer, ENT specialist. Concerning the strike, I'd like to tell the government that the hospital are running very smoothly because of the clinical officers. We are handling each and every case that is coming into the hospital, and we are comfortable. We don't have any issues, and we want the government to consider us when it comes to reward.
Pass back to you, Caroline. You said you're the Secretary General of
Nyeri County.
Nyeri County. Okay. Regarding the strike, as your colleague has indicated, you're doing most of the work. Are you the ones handling the patients now that the rest are away?
Yes, we actually are the ones actually doing everything as at now, because right from treatment, diagnosis, investigations are being done by the laboratory people because they are still here. And we also make decisions whether the patient should go to the wards. The wards are not fully opened completely, so we actually send the patients outside. But for now, if there is any emergency being handled in casualty, we are handling them. Yes.
Regarding the remuneration for clinical officers, what would you say about that?
The remuneration for clinical officers, we are underpaid, we are overworked. We actually do the donkey work as far as I'm concerned, and we are actually left out in everything, that in all the discussions, including, I will first say, for example, I'm a clinic officer anesthetist. Anesthesia, 95% of anesthesia is given by the clinic officer anesthetist. And when the doctors were given the call allowance, we were not considered. I have no idea why, because call allowance, I'm on call, the doctor is on call. So I put the patient to sleep, the doctor operates. And if I decide the patient is not fit for anesthesia, then he's not fit. So we play a very major role. Please let us not be left out in these things, because we need now, we are coming out clearly to tell the government it's time now we stood on our feet and started shaking the ground we are standing on.
Remarks from clinical officers based in Nyeri, they're saying that they feel left out, they feel neglected, they feel that the government does not quite consider their plight, they're overworked and underpaid, and as far as also the negotiations go, that the doctors and the nurses are trying to catch the attention of the government to try and improve their working conditions, to try and improve their remuneration. The clinical officers here, as you've heard, perhaps they're from Nyeri County, but what they're saying might resonate with other clinical officers in different parts of the country.
All right. Thank you very much, Carol Nderi, for that reporting. Now, moving